Oh, thank you.
More affordable. It strengthens Medicare and it provides better options for families.
I'd like to welcome everyone to our Affordable Care Act Information and Registration Session training. And I would like to acknowledge a few people before I get started and thank them for being here. We have from Regenesis Healthcare, Shante Moore, Sherry Mabry from South Carolina Progressive Network. We have, is Sheila Jackson here? Okay, Sheila Jackson. Beverly Foster, Sheba State Farm Insurance Agency. We have Lamont Glasgow, gentleman here. He's with First Choice Glasgow Financial Services. And also, I'd like to thank Reverend Benjamin Snoddy for allowing us to be here and put this on. And also, we have Ms. Carolyn Reed Smith, the Village Ministry, who's also an activist with the Affordable Care Act. I'm with the Ubuntu Institute. There's a couple of people here associated with Ubuntu. In the back here you have Cindy Ball, which has been very instrumental in putting this together. We have Wes Bernard over here, Vernon Fial in the back, there's Janet Spraggs, and Karen Anderson over here at the registration desk. And right quick, I'd like to tell you what the mission of Ubuntu is. And our mission is to impact and improve the education, health, economic condition, and the cultural consciousness of Black citizens in our immediate community in order to raise the standard of living for current and future generations. And the word Ubuntu is a Southern African word which means basically that we are all connected together as a whole. And our motto is, I am because you are. So that's the basis of Ubuntu. And we have this vision that somehow we can bring our community back together. If you're over 50, like I am, there's a time right here where we really supported one another. We had this family. And and now, it seems like there's something that's happening here, and we're having a hard time, getting it back. We talk about vision, and the vision isn't for us. The vision is really about our children and their children's children. And what we want to do right is try to bring that vision back into focus. So, we may end up generating, being something like a think tank, but also there is 4 areas that we do have committees working in. It's education, health and safety, economic development, and culture. So if anyone is interested in participating with us, joining, we have some cards here also. And, if you would like to work with us, just give it to us. All right, so also, what we're going to do is introduction of people from Regenesis, South Carolina Progressive Network. Also, I'm going to tell you about their part. And we have Karen Reed. People give a small presentation, and we get into the question and answer period. And go from there. Thank the people that showed up for the presentation. I appreciate you all coming out also. Thank you. There are some cards on the table that will also tell you about future Ubuntu programs coming up, particularly around Kwanzaa. We have Kwanzaa coming up, and also we have a few films that will be shown during the month. So also pick up one of these cards, please. So without further ado, I'd like for Shante Moore.
Wanda Vondevar, who's here, and she is available if anybody needs some Spanish translation. But at Regenesis, we are a community health center. We have locations in Spartanburg County and Cherokee County, and we provide affordable health care to people in this community. Most of our patients, we have patients who do have health insurance and patients who don't have health insurance. So if a person is not insured, we do not turn them away. Our services are not free, but they are provided on a sliding fee scale based on the person's income and based on their ability to pay. We see adults and children. We also have a dental office here on Church Street, and our main medical office is on Church Street. But Regenesis, our role in the Affordable Care Act is we are considered a certified designated organization. And we have certified application counselors, myself, one, and then we have another. And our role is to provide information or educate the community on what the affordable healthcare is. Also, to help people with the application process and help them get enrolled. And we do that by paper application or websites. And we're here to answer questions that you may have or guide you in the direction you need to go to make sure that you get enrolled as quickly and efficiently as possible. And we'll be here today helping you with that.
I'm here, I'm going to speak for Sheila, if it's all right with her. I'm here as a Sheila, as a certified navigator for the Affordable Care Act. I'm working with the South Carolina Progressive Network, and it's a coalition of grassroots activists, Mt.Moriah included, who have joined forces to promote social and economic justice in the Palmetto State. We created it in 1995 as a tool to engage South Carolinians in their communities and in their government. The network connects people to each other and to resources designed to leverage the work of progressive organizations. We meet in Rock Hill, Charleston, Columbia. I think they have a group here. We share information, coordinate projects, and plan events. Meetings are informal and always open to anyone interested in good government and improving the quality of life. We encourage you to join us. On January 14th, we're having a rally to expand Medicaid. A lot of people that we're trying to help have no income. Unless you make $11,490 a year in the state, you do not qualify for health care subsidies. And so there's a lot of people we're having to turn down. They're getting no coverage. But if our governor had accepted Medicaid expansion, everyone in the state could be covered. But on January 14th, we're rallying behind the State House to encourage our legislators to vote to expand Medicaid for everyone, and to fund education and to protect voting rights. But I'm here to help people navigate through the system as a Sheila. And
Morning.
Always giving honor to God in everything that we do and hoping that He blesses everything that we do. Thanking Dr. Benjamin Snoddy for allowing this program to be here. And also just to tell you that when you leave here, you need to tell everybody that you know that these activities are going on and that these meetings are going on, because there's just so much information that you don't know. And there's no real organized effort to make sure that you get all of the information. And we, as a community, always wait. We wait till the last minute, and then we say, man, I thought such and such. I could have sworn such and such, when there were meetings and information being presented so that you could know way ahead of time. This is December, and the open enrollment period ends in March. This is December, and the open enrollment period ends in March. There's a whole lot of stuff that you need to know between now and then. Do you qualify for a federal subsidy? If you do, what does that mean for you, and how can you get that? If you don't, what then are your choices? If you go out on the exchange, what does that mean for you? Can I get this insurance? Does my own insurance grandfather me in? There's a whole lot of questions and information that you need to ask way ahead of time so that when the deadline happens, you are prepared. We need to share the information and encourage us to stop waiting until the last minute, and then you don't have choices. Right now, you've got choices. I represent State Farm Insurance. I'm an independent agent with State Farm Insurance, and we offer just about every type of insurance that you can have. And when I say independent, I just mean that I work for State Farm. I am a State Farm insurance agent, and we do provide some coverage. We do not provide everything, but what we do as a service to the community, if you come in, I'm going to help you go online. I'm going to help you give you the questions to ask. I'm going to encourage you to go back to your employer if you have current insurance and help you go through the steps. And at the end of the day, if it's something that I'll offer, yes, I would love for you to purchase that from me, but that's not the criteria. The thing is, we want to help you. We want to help you. We want to encourage you, to encourage everybody that you know to wait for. If they're not here today, there's going to be other meetings like this. So you need to tell everybody that you know. Go back to your own centers of influence, your barber shop, your beauty shop, your church, everybody that you know, and tell them these meetings and this information is going on. It's free, it's true, it's informative, you need it. And I just want to encourage you to look out for professionals who have information, who are willing to share our time and our information with you. Make us work for you. Make us work for you. Make us work for you. Thank you.
My name is Mt. Glasgow. I represent Glasgow Financial Services. I'm a licensed independent insurance agent. I specialize in different types of insurance, various types of insurance, but I've really been focusing on senior benefits. And one of the things that I've done with the Affordable Health Care Act is that we sit down one-on-one with individuals in their homes, especially in the rural communities, and dispel a lot of the myths out there about the Affordable Health Care Act, especially when it comes to seniors. There are a lot of seniors who are under the impression they're going to be losing benefits, they're going to lose Medicare, and those things are just absolutely not true. And so it's important that, as Beverly said, that we come to things like this, that we sit down and talk with people one-on-one and let them know what's out there and what's going on. And so as an individual, it's just been my passion lately, just to deal with the seniors. I do insurance for everybody, but I want to make sure I've seen, because unfortunately in our country oftentimes seniors are left out. I go in rural communities and I meet individuals who hadn't seen a person in 2 and 3 days, 2 and 3 weeks at a time, and that's pretty sad that we live in a society like this. And so I want to make sure that seniors are educated, that they know what they have. As you stated, the income limits about Medicaid. There are people out there who don't even know that they have the option to get these benefits. And so it's our duty that for us to have this information that we disseminate to those who need it so we can take care of our country. But I have some cards over here I'll leave with you. But again, my name is Mt. Glasgow. I'm with Glasgow Financial Services. Thank you for allowing me to be here.
And also we have Carolyn Reed come up. She's kind of a watchdog for this. And you find out what she has to say.
Here that's explaining what the Affordable Care Act is. And you're going to get, some great information about what it is. I'm coming to you today to say, are we really going to be able to get all of the advantages of the Affordable Care Act? Now, someone is passing around to you a paper. On one side of it, there is like 40 highlights of what the Affordable Care Act has, the advantageous things about it. But on the opposite side is what I'm going to talk about. And I'm not really sure if this is the only time or am I going to be. The Affordable Care Act in South Carolina has been nullified. Do you know that our South Carolina legislators have passed laws that even if in 2014 they decide that they will take the expanded affordable care for Medicaid so that people 19 to 61 can take it, they have produced laws that's going to support the insurance companies so that the monies will still, the capital that's supposed to go back to the people so that you'll have lower rates is not going to come back to you. They have passed laws, and we need to know about these laws. We need to know what we need to do to try to advocate so that these laws can be taken off of the books. And if there are enough people that are interested in it, it can be done. But that's basically the key. I don't know totally how much it's going to interfere with what the healthcare system is. But I just want to show you the number of laws that have been passed to nullify the Affordable Care
January 14th is trying to show people in the legislators that people in the state want more. Mt.Moriah has some information about a bus going from Spartanburg to, if you want to become active in the state and let the state know how you feel, that's the best way.
So the rally is where?
It's at the State House, the back side of the State House.
In Columbia?
In Columbia. Mt.Moriah has the information about it. There's also some other flyers that I brought over. And I do want to stress that Monday, this coming Monday, December 23rd, is the deadline to be covered on January 1st. You have to pick a plan by December 23rd, and you have 10 days from there to pay the first premium. But Monday is the deadline if you want to be covered January 1st. Anytime between there, the 24th until January 15th to be covered March 1st. So, question?
How are the premiums decided? Is it basically whatever plan you choose to go on?
Yeah, you will, when we go through the program, if you're eligible for any subsidies, so you can choose to have them taken off the monthly payment if you like. I've seen payments as low as $32 a month after the subsidy, and I've seen them as high as $157, but nowhere near the $430, which is what some of them cost. So most people are eligible for some kind of subsidy, but we won't know until you get into the system. So, but I do encourage everyone here to try to sign up today if you're interested in health care on January 1st.
Elements of the Affordable Care Act, sometimes called Obamacare, are about to kick in, and big changes are coming to health insurance in 2014.
The Affordable Care Act, and what it means for you, your family, and your community. The first question most people have is, why did we need the healthcare law? The answer is that we had a health insurance market that worked very well for big insurance companies, but not so well for American families. Insurers could pick and choose who they give coverage to, and premiums were skyrocketing, even as insurers made record profits.
First, you can only get coverage during special enrollment periods, so if you snooze, you may lose. And second, thanks to something called the individual mandate, if you're not insured, you pay a fine, making this option seem not nearly so clever. Still, if you really can't afford to buy in and can't get insurance anywhere else, the government will waive the penalty, so don't panic. By now,
For them. It is going to be so important that we understand that I'm trying to say we need to be proactive in looking at these situations. Yes, we need this, but the reason why the insurance was supposed to be so low is because the way that President Obama said it was there were going to be a lot more young people that didn't have like major problems. They were going to come into the insurance companies, and that was going to help to bring the prices down. And then the second reason was that, like the thing was saying, that almost 80% of the money out of the monies that they had as capital gain, the money had to be turned back into helping to make sure that the insurance was going to be lowered. You know, everybody's always talking about we want to maximize our dollar. We want to make sure that the people that are the business owners, they get this extra money and then they put that in their pockets. But the way President Obama set it up was that these things weren't going to happen, that there was a specific amount of money that they truly had to make sure that their program was right, or they truly had to make sure that your insurance policies were going to decrease. One of the major things that bothered me was that President Obama put specifically in there that there would be larger amounts of money set aside so that if people had need of mental health, help. That was one of the things that was very important. Now, when we think about what's happening today in our society, we're looking at more and more people are confused, needing problems, and they'll either go out and shoot themselves as well as their loved ones, or they're aggravated in the workplace and they will go out and shoot someone and then, you know, just major damage, do major damage. So let me just show you one of the things that's on the paper that you have there. You should have the back side of it. Number 31 near the bottom, I'm talking about the side that has the different laws. Okay. One of the things that mental health services, the last one on that side, South Carolina Bill number 3560, so as to require collection of information on individuals who have been a mental patient or committed to a mental institution for the submission of this information to a national instant criminal background check system. Okay? What does that mean? It means if you have mental health issues from the past, the future, or if you seek mental health issues to be corrected, it's going to show up on your SLED check. So whenever you go to a job and they say, okay, well, let me give you information, get your information so that I can SLED check you to make sure you haven't gone to jail. That SLED check is also going to show that you've had mental health issues. So what does that divert? It diverts the employer having to pay mental health for you. So what they do, they see you had mental health issues, so they don't hire you. Discriminatory. This is one of the laws that have been used to divert the ability of the Obamacare to work, and that is for people to really have, let's go to the top of the page, number 3. House Bill 3560, so as to require collection of information, I'm sorry, that's not it. Go down one. 0460. It was ratified into law, and it says that there is a director of the Department of Insurance may require from a broker seeking a place of business in a non-admitted insurer. Non-admitted insurer, what does that mean? It means there are going to be insurance companies that are in the federal exchange. If you go to the federal exchange law, and then they want to do work in South Carolina, then they could put further requirements on them so that they would possibly end up having to have higher increases, or they won't be able to work in South Carolina at all. So when you go to the federal exchange and you sign up for a company that is not a South Carolina company, then it's a possibility that they'll have to work and pay more, and then that would increase the amount that you have to pay. So we have to watch this. This is all I'm saying, is we have to watch it. When 2014 comes in, that's when we're going to find out if we're going to have these problems. Bill number 3621 also is talking about the authority to transact business in the state by an insurer. That's another one of those things. I'm hoping that the sheet that I gave you is the one that I wrote several other bills in there that I just didn't understand totally. I don't understand all of what these things can do against us, but I know that they have put these bills in place so that the monies will not have to be turned over, and that 80% that they're talking about, they can't raise rates, they can't do all these different things that are opposite what the Affordable Care Act has said that they need to do. So it's so important for us to look at these things, to try to pull ourselves together. That's why I'm really glad about this group. If they're meeting and saying, we're going to start looking at it, we need to have a group of people that's also saying, I understand, and I want to make sure that South Carolina is going to get the expanded Medicaid for people that are from going to college age all the way up to 61. I want to make sure that that comes in here. And when it gets here, I want to make sure that we get all of the advantages that the Affordable Care Act has written for us in that situation. So we have so much. Now, how often do we sit around and talk about preserving our rights as citizens? How often do we? The reason why these things are so subliminal, we might not ever see this. The propaganda is there. They're already talking about, because of Obamacare, you're going to be having premiums. If you watch television, your premiums are going up because of Obamacare. That's not true. Our premiums might go up, and it's because of the laws that they've set aside. There was a There was a person that was flown in to South Carolina, and he instructed our state government on how to nullify the Obamacare. He gives them the direct laws, they give them what to say just about. You know, I don't know if you ever watch Al Sharpton, but he can sit there and dictate to you. He'll pull the little scenes and he'll show how this person is saying exactly what a person that is a member of this group called ALEC had told them to say. And they are getting funds for doing that. So it is so important for us to understand, as we're sitting here nonchalantly, not doing anything, not saying anything about what's going on in our society, people are meeting on a weekly basis. Businesses are paying money to a group so that they can get laws written that is going to help them. And that's exactly what's happening to us. I have another one that I have it on the table, but I didn't pass it out, but it's called ALEC. It's got ALEC on it. And it says American Legislative Exchange Council. This council meets all the time, and this is a nonprofit group that they've organized, and it has a list of all the some of the businesses that are in that group. And that is, you're pulling together a group of people that's saying we're going to make ourselves aware of what's going on, and then we're going to try to educate the masses. And we, as the masses, need to be.
Okay. Gina, tell her.
He's probably gonna ask his sister.
Can you hear the girl?
I think so. Click it again.
So double click.
Try double click. There you are. There. There. Try it.
Right here.
Click it. Yeah. See what happens.
Double click.
Usually.
Other training coming up here in the future also. We got some training at the House of Prayer at Macedonia and Cornerstone. So if you're interested in those dates and times, see us also over here at the desk.